First, we're going to go through a scenario, and then we're going to pull 2 questions from that scenario. A 22-year-old male is playing in a recreational soccer game when he collides with another player and falls hard onto his right side. Bystanders state he got up immediately, but began complaining of chest pain and shortness of breath several minutes later. On arrival, the patient's sitting upright on the sidelines, anxious but alert. Heart rate's 126, blood pressure's 136/86, respirations are 26, and the O2 sat is 91% on room air. Let's pull 2 questions from the scenario, but I'm not going to give you the answers yet because I want you to try to figure it out without having the multiple choice. Question number 1, what is the most likely condition affecting this patient? What do you guys think? And question number 2, what's the most appropriate treatment for this patient at this time? Now let's look at those answers. So for question number 1, we got A, a simple pneumothorax, B, a tension pneumothorax, C, a pulmonary embolism, and D, cardiac tamponade. And for question number 2, we got A, assistive ventilations with a BVM using positive pressure ventilation, B, administer high flow oxygen and closely monitor it for deterioration, C, apply CPAP and improve oxygenation and reduce respiratory effort, and D, place the patient supine to improve their ventilations. Every day we break down a different difficult national registry question and dissect it. We do it using this 4-step method. So here's the 4-step method that you can use whenever you're challenged by a difficult question. Step number 1 is recognizing the clues. So let's take a look at what clues we have available to us. The first clue is that he falls on the right side, which means the chances of an injury to the heart are pretty minimal. And we know that the patient has chest pain and shortness of breath. But here's the really big clue, the vitals. We notice that heart rate is elevated, but the BP is really normal tensive. But the respirations and the pulse ox make it pretty obvious that this patient's hypoxic. Now, the biggest clue we got in this scenario is the normal blood pressure, and I'll get to why. But we also have an elevated respiratory rate and a decreased pulse ox. And then we have the mechanism of injury. And there's a pattern here. So the patient has a pneumothorax, and I'm sure a lot of you already know that. But how we get there, regardless of whether you knew the answer to this question, is the most important part, because that's what this video is about, is dissecting the questions. Because even if you guess pneumothorax, you still have a chance of messing this question up. Now, there's 2 types of pneumothorax. There's a simple pneumothorax and a tension pneumothorax. And this is a simple pneumothorax. Let's break down what's going on. In normal breathing, we use negative pressure to draw in air, but when we have a collapsed lung, you can't generate that negative pressure.